Alrighty, now we should be live on YouTube and in the Facebook group. We'll wait for some people to get on here, but if it's your first time tuning in, today we're going to be talking about the insurance, medical insurance, COVID insurance, home insurance, all these insurance things with Phil Eitman. And so we'll wait a little bit. But if you're watching the replay, say hello, let us know where you're from, drop your questions below. We can go back and get them answered for you. And looks like we got one person on here. And let us know where you're from. So if you're popping on, let me know where are you from, where are you tuning in from, where are you in the process of your move. If you're tuning in from Facebook, remember that I can't see your actual name. It just says Facebook user. So you can go ahead and type in your name and then also type in where you're from and who you are and where you're tuning in from. But we'll just wait a few minutes. All right, okay. There's more people.
So where are you now?
I'm in Hako.
Okay.
Yeah. Never thought I'd say I'd be living here.
Yeah, I wanted to do this on the beach today, but I couldn't have it set up. Usually, a little ocean going behind you is always a little bit better.
Yeah, nice and tranquil. It's nice that the beaches are open later now too. Alrighty, well, we can. Okay, someone's on Facebook there. Oh, it's Kara. She's from Kelowna, Canada, British Columbia. Cindy's from Canada. Cindy's on YouTube. She says hi from Canada. So it looks like we got some Canadians on here.
Hey, Canada.
And where were you from again, Phil?
I'm from New Jersey.
Okay. Oh, yeah. I remember you told me that.
But no more.
No.
I've been here 16 years.
Wow, yep.
The only thing I miss is a slice of pizza and a cannoli.
Someone posted a post in one of the Facebook groups saying, like, what do you miss when you're in Costa Rica? And I put Chinese food, like good Chinese food. And, oh, shoot, I don't remember the other thing I put.
That's all everybody misses is the food.
Good Chinese food. Oh, and the queso dip, that Mexican queso dip. That was another thing I miss.
Yeah, I was in New York about 9 months ago. I was like, give me the street hot dogs, give me the pretzels, and give me the slices. That's all I ate for a few days.
Alrighty. Well, I'm going to let you get into it. For people that are just tuning in today, we're going to be talking about insurance in Costa Rica. So definitely number one, I know a lot of people have questions about this coronavirus insurance that is required for people entering now that we're open to Canada and other countries, and then eventually to the United States. I'm assuming that this insurance will still be applicable by then. So it'll be good to have this information. Things were changing so much when they first came out with this, so I didn't want to post on it or really do any information on it because I had a feeling that they were going to change things up on us. So I figured now is a good time for us to get into the subject. Also, Phil's going to go over other insurance. I mean, I've had people ask me about, okay, what about just normal health insurance? How do I insure my car, my home? So I'm going to let Phil just take it from here. He's an insurance expert, and I'm excited for him to be able to share his knowledge with you.
Okay, how you doing? So I believe the key is to really first have a relationship with just about everybody you talk to when it comes to insurance, because everybody has a different need as opposed to just searching for things online and answering online. So I'm very happy to have this opportunity to speak to you here. My story basically about me is I came here about 15, 16 years ago from New Jersey to work on a couple of big projects. Very large projects. And part of my role was to go and meet other owners of other projects and real estate agents up and down the Guanacaste coast, which is the Northwest Pacific side of Costa Rica. And that project never came to fruition. And so I'm here, and about 11 years ago, my daughter moved here to finish high school, her last 2 years. And so I looked into international health insurance. I didn't even know it existed. I was here without insurance for several years, for about 7 years. And as you can imagine, for anybody from the US, that's a dangerous thing to do. So I looked into it, and I researched it a little bit, and I got into the business and started presenting it to all the contacts I had made. What was interesting is there is insurance, but typically no one will return phone calls. Sometimes in Costa Rica, that's how it is. So I found a niche in to build a business designed like an American office with people who are 100% bilingual. I'm from New Jersey, so people really do respond. and aggressively too. And if you have an issue, they respond like a aggressive family member, help my family immediately. So roll ahead 10 years, they've issued about 2,000 policies, all to 99% of them to expats that have moved to Costa Rica. Hundreds of homes, hundreds of cars, hundreds of international health insurance policies. We have a bilingual staff that's been with me now for years that works all the time. And I start off by going back to what Sarah first brought up was the COVID situation. Luckily, where I live in Costa, there's no cases. So I'm in a COVID-free zone, which is absolutely incredible. But the Costa Rica government first started allowing some protocols, had some protocols that allow certain people to come in from certain countries. Canada is one of them. Countries Costa Rica thought those countries had the COVID under control. Now, the Costa Rica government required, the Minister of Health required a certain type of insurance for expats or people to come here. They first only opened it up to tourists, not for people moving here, for people only coming for a specific time. If you're coming for 2 weeks, 3 weeks, a month, or 90 days, that's all that first step was for. And the insurance that was designed by a state-sponsored insurance company, INS, was super expensive, really expensive. And that was like 3 weeks ago, and 4 weeks ago. And of course, a tremendous amount of pressure came on them. And since then, it has been lowered to be even manageable, not that expensive right now. But it is required for anybody coming now, and you must come with a entry date and an exit date, and then we can give you quotes. It's a pretty simple process to do, and you get this little subsidiary travel insurance. My feeling is that if you're coming in 2 months, or 1 month or longer, wait, because the situation step by step is opening up more and more and more. So there's no reason to, if you're not coming in the next month, to buy anything right now, because maybe in 2 months, there are many other insurance companies out there that cover COVID, but not with the specific requirement that the Costa Rica government is requiring. So they'll probably open that up. I would expect by November, they will open up quite a bit. People have asked me for 5 months, what do I think was going to happen? My prediction was November. So if things don't open up by the high season, there's going to be tremendous pressure on the government to do that. So, and I think, so as far as the travel insurance to get here for a short trip, if you need to do it now, like in the next 2 weeks, we can set you up with that, or guide you how to do it. If it's going to be longer than that, I would just stay in touch, and because things will keep evolving. Now, to get onto another subject, just to go over the list of things we've done, because what I found when I first got into the insurance business was I realized why everybody hated the insurance companies, because nobody knows what they're talking about. So I'm the person that asks a lot of questions. So I read all the policies. I read all the policies. So when people have problems and claims, I know what the policy says. Most of it's common sense. Should just be covered or not be covered. It's not like it's in the U.S. or Canada, but you can tell whether something should be covered or not. We don't accept what anybody says is true, because we catch them all the time. Oh, that's not covered. What about paragraph 675, sub A, sub I, number 2? And so we've learned not to believe anybody on anything when it comes to insurance. Most of the people who move here have no idea about the country. They look for us to be the person to ask just about any question, because if somebody gets in an accident, hits their head, it's like, now where do I go? Where's my doctor? Where's the hospital? What's the policy say? So typically we just say, text us. And we set up a text, we set up a chat, and then we're all in communication, helping you guide through that. So being from New Jersey, we're very aggressive about making sure our clients are taken care of. So just a note on the car insurance. Typically, if you have a car that's about $18,000 or more here, maybe you want to get full coverage. That's collision, roadside service, and third-party liability. It runs about $1,000 a year, plus or minus $100 or so. It's not that expensive.
Not expensive at all.
But if you have a car that's you buy an old beater, it's like $5,000, $6,000, or $7,000. You don't need all that because people don't fix their scratches here. There's nobody really to show off their cars to, and so you just can maybe get third-party liability and roadside service. And here's an example how it works. It's unbelievable. My wife took my car, used all the diesel in it, and the diesel runs forever. So I had to go somewhere, and of course I ran out of gas yesterday. Unbelievable. So I ran out of gas yesterday in the middle of nowhere. I called the insurance company. Monday was a holiday, of course. And, yes, Monday's a holiday. Somebody came in 20 minutes and filled my car with gas. End of story. Fantastic. That's how I've been here long enough. I've seen all the experience. I know everything that's going on. We've had a lot of experience. So the car, that takes care of the car insurance. Everybody should at least get the roadside service, because breaking down somewhere can just ruin your day. Home insurance is the next thing with people buying homes. We'd like to, get an idea of how that works. It's pretty expensive. The big thing here is fire, earthquake, tsunami, landslides, trees falling. You turn your, thinking of claims that have happened, things like your power, you're cooking something, the power goes off, you leave the house, power comes on, burns your house down, burns your kitchen. This has happened. And so, but the insurance is pretty cheap. It runs about $200 a year per 100,000 in construction. So if you have a house that's 200,000 or in construction value, then the insurance would run about $400. So that's a good boilerplate number, $200 a year per 100,000. We worked with many companies here. We know which ones are better than others. We know which ones will give us less of a hassle when it comes to claims. The most important thing I find is who's really going to process the claim when you need it. That's the most important thing. And being here for so long, we are the largest in our area of car insurance, the largest with homes, and number one producer with homes, and also for health insurance. So we carry a little weight when we call the general managers. They definitely take my call. I try to avoid that because they cringe if I have to call them, but I try to avoid that. But we do get our phone calls are answered, and we do provide, I think, incredible service. That's why we do so well. That's all I really care about is the service to our clients. When it comes to international health insurance, that is a must. I mean, the Costa Rica health insurance is good. The private hospitals are good. The public hospital, sometimes they're good, sometimes they're not. They're depending how many COVID patients. Now they're a little crowded, but I definitely recommend anybody to get private health care. It's private health care here there's no wait. Depending on the program, you could use it anywhere in the world. You can elect to use it here, or elect to go to another country, your home country, to get treated for something if you want, depending on your plan. What's unique about Costa Rica compared to the U.S. and probably Canada too, is that if you go to the private hospital with an emergency and you don't have a cash, credit card, or insurance, they're going to kick you out until you go to a public hospital. Now, if you think, by definition, a public hospital is Costa Rica, quasi third world public healthcare compared to other countries such as Canada healthcare. So you could just imagine the step down that would be. So I encourage everybody to get private health insurance. The couple examples of how it works is that we had a client first day back in the United States. After a few months, maybe longer, she got into a head-on collision. Her husband texts me. She's being airlifted to San Antonio Hospital. Phil, can you please take care of the insurance? That's when my team jumps in. Her claims are over $500,000. Everything paid for but the claims. crazy air ambulance. We had an air ambulance, same thing happened in Lake Tahoe, another $100,000 claim. We had clients that needed a hip replacement in, they were here in Costa Rica, but they elected to go to the U.S. to have it done. Another client had cancer treatments. They elected to go to MD Anderson in the U.S. So you can, depending on your insurance, we had another client, he thought his wife had cancer, elected to go to Canada to have it checked out. So you're able, depending on your policy, you're able to go wherever you want. So if you move here, as an example, like I had cancer about 5 years ago and came out of nowhere, surfed every day, perfect health. And so I got diagnosed here, and they want to do some surgery. They didn't know chemo. Wasn't sure what to do. And I said, whoa, I have international insurance. Let me go to a cancer clinic in Miami, diagnosed there, did chemo in Costa Rica. So I was able to go back and forth. The doctor here is fantastic, my oncologist. I'm able to text him now if I have a cough, and he'll respond. He'll tell me what type of over-the-counter cough medicine to take. It's unbelievable. Mm-hmm. But I'm glad I had options to get diagnosis anywhere. So I went through the whole thing. I beat it. I went bald. Now I can't wear my hair a little bit long, just as like, to you cancer. So, the thing about it is that most years ago, people would say, if I get cancer, if I get sick, it's over. I'm going home, whatever, it's over. It's not like that anymore. So you don't have to, if you're here with your family and somebody gets sick or has some ailment, you don't have to uproot everybody to return. You can do things back and forth and stay here. You have kids in school, or you're retired here and you really don't have a home left in North America, you can just stay here and go back and forth, whatever you want to do. It's like a borderless type of policy. That's what you want to do. And when these emergencies come up, I actually say this is when we really shine, that my team is so good. I tell everybody, use them as your personal assistant when it comes to claims, doctor appointments, coordinating anything, and they're on it. And you'll be involved in seeing what's going on behind the scenes every step of the way. We also added immigration and residency services to our program. We're not out there promoting it all the time because it's a lot of work, but for our clients, we like to provide their service and make sure they're taken care of properly and not getting to run around from somebody who just collects their fee and see you later. So we try to really, provide a really good service and want people to move here and be happy and not tortured. I've been tortured. I've gone through it. My team has gone through it. We've all gone through it. So we know what to expect. And we know when somebody's telling us the truth or not. It's and how the process works. I think that pretty much covers it all.
Okay. I think I might have a few questions, and then we can go over questions that people have. So anyone watching, feel free to drop your questions in the comments. I'm going to be going through them. Okay. So my question, I understand like the health insurance for if there's an emergency, but let's say someone like me, I hardly ever go to the doctor. Would that insurance cover me? If I do need to go to the doctor in Costa Rica, I usually do go to a private one because if there's no lines, it's just super easy rather than going to the public system. But would you recommend, how does that work? Is there like a deductible or like a copay or so for someone like me who just wants to go to a private doctor would want to?
I got you. Not to cut you off, I heard the question about 10 million times. I know exactly what you're asking. Well, the plans have deductibles. So obviously, the lower the deductible, the higher your premium is going to be. There's really no need to get a low deductible plan here. Most people get plans between $2,500 and $5,000 deductibles because these are things that are going to be really cheap or they're going to be a lot. And most people want to be protected against something catastrophic happens. So if you have a stomach ache, and you go to the doctor, you really could go to the pharmacy here because the pharmacy is going to know exactly what's going on. It's going to tell you what you need. You really don't need to go to the doctor. Right.
We got a bad stomach virus and we were out all day.
So you wouldn't, in the U.S. as an example, you wouldn't go to the pharmacy for advice on that. You would go to a doctor. Here, the doctors own pharmacies. That's in most of the cases. So you can just go there and say, yeah, I've seen 10 of these already this week. And they'll tell you what to do. So if if you have something, if you want to go to the doctor's $50 or $100 or something going on, you get medication, you can put in a claim and we could apply that against your deductible. So if something serious happens, maybe you have $50 or $100 into it. But the cost benefit of getting a lower deductible isn't worth it for the extra premium you're going to have to pay.
Okay. Okay. Let's see what other questions people have. Alrighty. Okay, just to stay on the health topic, someone did ask if will we need renter's insurance? Have you ever heard of that?
Yeah, well, the way renter's insurance works, in Costa Rica, you can only insure property that you own. So the person who owns the house that you're renting would have insurance on his property. So if you're renting the house from him and he burns down and you burn down the house, that's his responsibility. If you're renting a house and you have your belongings you want to insure, you could do that, but most people will have like $25,000 in belongings, and it's maybe cost you $100 a year.
Okay.
The other thing, since we're on renters, is that if you own a house and you're renting it, you can get third-party liability insurance. So if somebody gets hurt in the property, and for $100,000, it's about $340 a year. That's for if you are renting your property to somebody else.
Mm-hmm.
And 10 years, nobody's collected on that. This is not a litigious country. So the judge would probably say, it's not the owner's fault. This drunk jumped off your balcony and missed the pool by 5 feet. So that's how they look at it.
Definitely. Well, I guess with that also, so if you said people can get personal insurance, let's say if you have like a expensive computer, camera, things like that, could you insure those items? That way in case they're stolen? That's good.
Yes, well, there's theft insurance is a little bit extra. That's a little bit more. And then it's a process. You have to go file with the nuncio. The best thing is just be careful of petty theft. And if you have a safe, that'd be great to put your computers, phones, and laptops and passports and cameras away. That's the easiest thing to do.
Yeah. Okay. So let's see. Someone asked, wait, can you get health INS? I guess if they have a pre-existing condition. So how does that work with insurance, to INS or any other company?
They all have exclusions or 3 things that happen with pre-existing conditions. 1, they can deny you. 2, they can give you an exclusion for that condition. 3, they may give you a surcharge or maybe cover it. Depending on what it is, if you were to let me know or email me, we can get you an idea where to. We can do a little research and tell you what it's going to look like. Sometimes people with pre-existing conditions end up becoming residents, and they still can get coverage from the public healthcare, which is CAHA, which I found what I found them best for is if you have a prescription and you have an ongoing prescription that's under your deductible or it's not covered by the private healthcare, you can get that from the CAHA. Other than that, I would try to avoid them.
Okay. All right. Lisa asks, I know there are a lot of variables to consider, but what would a range of premiums be for international health insurance that they could expect to see? So I guess what is kind of the lowest?
What's your age?
I don't. Lisa, how old are you? I don't remember. Lisa's actually one client that I'm in contact with a lot.
Okay.
Greg asked, he's 59, male, healthy, BMI 28, not taking any medications. What would a roughly yearly estimate range?
And where are you from? I'm going to tell you right now.
I think Lisa and Greg are from the United States.
Okay, and there's 49 you said about? Okay.
Well, Greg said he's 59.
Okay.
Lisa's 59 too. Okay, so.
Okay. Well, if you want to get a good plan that covers you, let's say, typically, I would say for them a $5,000 deductible. Because you really want to protect yourself against something catastrophic happening that could be hundreds of thousands of dollars, unlimited air ambulance and all that. For them, that would cost about $800 a year. I'm sorry, $800 a month.
Okay.
There's some lesser plans, which I could probably bring it down to 560, 565 a month. So
Okay.
depending on the level, so 500 to 900 a month will give you a really good plan. If you could compare apples to apples, if they have private health care in the U.S., it's generally about a third the price. So it's about a third of what it would cost apples to apples. And in fact, if somebody's here for a while with this particular plan and they decide to move back to their home country, they can keep the same insurance and they'll add a surcharge, which would still be cheaper than if they got the insurance directly as a private person in the States.
That's pretty incredible.
Yeah. So if a family of four could be a typical family of four could be like $500 a month.
Okay. Okay, so that's not too bad. All right. So it sounds
about a third.
Existing conditions are kind of just determined. I mean, a lot of these things I know you'd have to speak one-on-one with somebody. Leo asks, are premiums based per person or are family premiums available?
If it's a husband and wife, if two people, let's put it this way, a husband and wife together, how can I best phrase this? Two people together will save about $400 a year. Okay. Versus one person. And then if you have one child, that adds maybe like $800 a year. The second child, like $500 a year, and the third child, like free.
Okay.
Something like that.
All right. And then let's see, what do you think the range would be for someone maybe who's in their late 20s, early 30s, or mid 30s? Do you think does that change a lot? Would it still be that possible $500 to $800 a month, or? Oh,
that would change. That to $800 was for two people.
Oh, okay.
Combined.
Ah, okay. Two people combined. Oh, okay.
Now you're saying that's really cheap. Actually, two people combined.
Okay, I was like, oh gosh.
Okay. All right, so let's just do one person.
Yeah. So maybe one person, higher rank, older, and then.
All right, 30. All right, we got 30-year-old, $5,000 deductible, great insurance here, great insurance in the U.S., great insurance all over the world. $175 a month.
Okay. Oh, that's great.
And so it'd be anywhere from 175 or 150 to 250.
Okay. Okay.
Which is about a third of the U.S. So that's for one person, 30. Two people would basically be about double that, basically.
Okay.
A little bit less, though.
So then that quote for the two people who maybe are in their late 50s, 60s, so that wouldn't be 500. That would be per person, about 250 to 400 per person per month then?
Yeah, let me just check that. Yeah, it would be to 250 to 400 a person.
Okay, well that's good. That way people at least can have an idea of what to budget for. I've done other videos about, medical care, and I've kind of said, the CAHA can be good for those little things like the prescriptions or small things, and it is nice. You can go to the pharmacy pretty much for anything here, and there's usually a doctor actually at the pharmacy. That's what we've been doing.
So it's the catastrophic stuff. The stuff happens here, and from big claims, cancer, accidents, people falling out of trees, people tripping in the street, somebody walk on the street, there's no code, she tripped, she broke her leg, bones went through it, in the hospital for 6 days. Also this specific plan covers COVID, covers a pandemic. And that's important. Some plans out there don't. Some plans online don't. They don't tell you that, but it's in the fine print. This one does.
So this insurance that might be good for someone who's moving long-term also covers COVID?
Yes. So the long-term plan covers COVID. At this point, you can't use this plan to enter the country. But this is, over the years, this type of plan is what most of my clients have. Something that's really good if something catastrophic happens and covers. Because I was always the person when I got my insurance, I don't know anything about it. something happens to me, here's my card, give me the best in the world.
Mm-hmm.
And which everybody does, they go on the internet and figure out they want the best in the world, and that's all I cared about, and thank God I did that.
Mm-hmm. Absolutely. Okay, Leo has a question. Well, I guess about pre-existing conditions again. How are pre-existing conditions addressed with health insurance in Costa Rica? But I think we went over that. You kind of noted that it really just depends on the policy. They might exclude it, or may deny the policy altogether. Is that correct?
Yes, or possibly cover it, depending what it is.
Yeah. Okay, so that would just be a case-by-case basis. All right. Is there anything else or do you have any advice for people that are moving here? Any of your own tips? As an expat living here for many years, I guess what would be some of your top tips of advice that you would give to someone who's going to be making the move?
I would say the first thing is do it as soon as possible. The second thing is, people ask me about this. What's it like being in Costa Rica? And in the beginning, I said it was like being in college. Everybody did a little work. Everybody got along with everybody. Everybody had a good time, and everybody wanted to be here. And there's a few types of people that are. There's a few types of people out there. Is that people who are going to say you're crazy for coming here because they're too scared to do it themselves. And there's the other people that are going to say, yeah, we're going to come, and they never do. And then there's the rest of us, including you, that actually did it. So all of us actually did it and have this common thread of DNA that we all did this. And so I'm friends with people that I would walk across the street if I saw them walking in my hometown. So, we're just, and I have good friends from 25 to 80. There's no discrimination of anything here. Everybody gets along with everybody. It's really a unique place when it comes to that. And you'll find that it's, for years in the beginning, my friends in the States wouldn't talk to me when I called them. And I finally got one on the phone, and I said, why don't you take my calls? He goes, well, I'm up here shoveling snow, paying high taxes, and every time I hang up with you, I feel like I want to hang myself. So with that, I said, okay, I got it. I had to tone it down so I can talk to people. But after a while, that's really what I think. I think my advice is get here as soon as possible. I think when it comes to health insurance, you want to pick out a plan as soon as possible, see if we get you approved and how you're going to get approved, like earlier the better. We can ask you also about your preconditions personally through email, which I'm sure Sarah will present. And questions about doctors in specific areas, which hospitals are better, and we can really guide you. You're coming into a foreign country, and most people have no clue about it, what it's like when you get here. But we have tremendous support along the way to make you feel at home, and we're happy to share it with you. Yeah,
absolutely. It's definitely different. Things are just done differently here, so it's nice to kind of have that support and work with people that know what they're doing. That's why I find good people to refer my clients to, because I want them to work with people who are going to treat them the best, take care of them really well, and make sure they feel comfortable. Okay. Well, anybody have any more questions before we sign off here? I just want to thank you so much for your time, Phil. If anyone wants to get in contact with Phil, you just want to share your email, or they could email me. I could connect you guys.
Here's my email. I try to make it as simple as possible. Phil.
I'll have the description too.
PhilCostaRica@gmail.com.
It's very simple.
PHIL CostaRica@gmail.com. I did that to avoid any spelling mistakes, hopefully. In Costa Rica, they spell it FILL. But still Costa Rica.
Yeah. Well, great. Then I guess if anyone wants to get in contact. So if someone is coming down, you said probably about 2 weeks before their trip, you'd recommend they get in contact to set up their insurance?
Yes. For travel. If they're coming down for a move permanently, you should do it a couple of months in advance.
Oh, okay. So then they might want to get in contact with you now. Yeah, most of the people that the audience is probably people that are moving. I pretty much just work with people who are moving. I don't really work with people who are just coming down on vacations, which is great. I want people to enjoy their vacation too, but being on a vacation here, moving here is a total different ball game. So I just focus in one area.
Okay. Perfect.
Elena asked if we have any info on car insurance. Phil did go over car insurance in this live. When we do sign off here, it'll be available for replay. So, you went over about the general numbers for, a car about in the $18,000 range. I think that was about $1,000 a year, and kind of what that covers and what you would recommend. Someone says, thank you for all the information. Looking forward to getting insurance with you down the road. Lisa says, thank you. I'm getting a lot of thank you, Phils. Someone had a nice comment earlier, too. They said, thanks, Phil. That was very helpful. Cheers. Wow, Phil. My wife, Heather, and I are both writing all this down. This is extremely helpful.
Pura vida.
Yeah, so I want to thank you for your time. And make sure I didn't miss anything before I log off here. If I ever miss someone's question, I apologize. Shoot me a message and say, hey, you missed this one. I try to get all of them. All right. Well, I guess that is it. And
all right. Great. Thank you for your time. Good talking to you all. Hope to see you in Pura Vida world.
All right. Yep. Thank you so much. And as you guys know, you can always reach out to me if you have any questions about your move, if you need help coordinating things, and just with any questions and support that you might need. All right. Bye-bye.
All right. Bye-bye.